Trauma in Children Related to School Shootings, with Kristine Pendy, Chief Clinical Officer of Behavioral Health Services. What are our children experiencing?
Our children experience a lot of stimulation. Unfortunately, post-pandemic, we have our children much more connected to video, social media, as a form of education that they have grown comfortable with.
What should parents and educators do in light of recent events?
Now what we have to do in the light of these recent events is really help to detach our children from social media and from the news, because they're not prepared, or at different ages, they're not able to understand the different facts that are being presented and the different reactions that they can have to these complex situations can span a lot of different concerning areas that parents need to be very much attentive to, along with the education system, so that our children are able to really understand and put into perspective what is happening around them and manage their experiences.
How can parents address fears children have about lockdown drills?
So we have to make it so that they understand why the things are happening around them, what the purpose is, what the education is for them, and normalize it so that they know that if they're ever in a challenging situation, that they know how to handle it for themselves, for their fellow students, for those folks around them, and that they're managing a bit some of their fear and their anxiety. So it's really important for us to explain each situation to them, to let them talk, to listen, and to really know that it's okay for them to experience fear and concern, for them to have initial reactions of even being a little bit panicked or even not wanting to go to school because of some anxiety.
Is it normal for children to feel anxious about this issue?
For parents, what's important is that this is a normal reaction to a very almost catastrophic event. And the more that our children are exposed to it, the more questions they're going to have and the more information they're going to want to know. So we have to be okay with talking about those complex situations at the level that the child is at, so that they can understand it and they can put it into perspective in their best interest based on the situation.
How can Bergen Newbridge Medical Center help?
We have very specialized services for our children and a very strong connection to our community as well as our school system. We are always here and available to provide whatever service or training or interventions that would benefit not only the residents that are in our community, but those who come to Bergen Newbridge Medical Center to seek our care.
What are some of the common signs of trauma in children? Pounding heart, nausea and vomiting, wetting the bed, nightmares and night terrors, separation anxiety, sudden outbursts, irregular sleep patterns, lack of appetite, refusal to attend school and activities. If you or someone you care about needs assistance, call our Access Center 24/7 at 800-730-2762.